right now, we're in the middle of an explosion of an understanding of how this disease occurs. One of the things my patients always ask me when they come the very first visit is, how did I get this? We know, or we're having a much better understanding than we used to know. It's usually not your fault. It's nothing you did, except you were on the planet long enough. We know that as you age, your bone marrow stem cells will accumulate mutations, and we can even follow their progression. People walking the streets, unfortunately, have the seeds of the disease within them through nothing that we know that they've done. And it then takes different paths, resulting in acute myeloid leukemia that are of different subtypes, different characteristics. Whatever combination of mutations you have a different flavor of acute myeloid leukemia. It's going to require a different therapeutic approach, a piecemeal approach. So now our understanding of the disease is very different than it was 20 years ago, when there were all these odd little cells, these white blood cells, too many of them, and they all seemed the same. Now we look at the disease very differently. Each AML is a different subtype, 20, 30 different subtypes, composed of mutation A and mutation D, mutation B and mutation J, and mutation K. And treating those is going to require individualizing the therapy like nothing we ever imagined 15 or 20 years ago. There isn't going to be, I think, a leukemia pill that will fix AML. There will be a series of AML pills or AML IV therapies, or whatever we want to call it, that will have to be combined in a clever sort of algorithm. And so, again, truly personalized medicine going forward. But we're just at the cusp of beginning to, the agents are just emerging now where we're going to start trying to do this. And so everybody's looking at combining these novel agents to hit the individual mutations of each patient.